You start losing weight. You feel better. Maybe your labs improve. Your cravings quiet down. Your confidence goes up. And then you wonder, can I stay on Wegovy forever? Or is there a point where it becomes risky? Let us talk about the real science behind long-term Wegovy use, how long people are staying on it, what the research shows, and what side effects doctors are keeping an eye on as the months and years go by. First things first, Wegovy is designed as a chronic treatment, not a quick fix. That means the FDA approved it with the understanding that patients may stay on it long-term, just like blood pressure or cholesterol medications. But how long is long? Most of the original clinical trials ran for about 68 weeks. That is a little over a year. In that time, people lost an average of 15% of their body weight and kept most of it off. Then came extension studies, where patients continued taking the drug for 2 years or more, and the weight stayed off as long as they stayed on it. But when they stopped, many regained a significant portion within a few months. That tells us something important. Wegovy is not curing obesity. It is managing it. Like any chronic condition, stopping the treatment often means symptoms return. Now, what about safety? Here's what we know so far. No long-term increase in cardiovascular events has been reported in the trials. Thyroid tumors were a concern in rats, but so far not confirmed in humans. Still, the warning label is there as a precaution. Some rare cases of pancreatitis and gallbladder disease have shown up, and doctors are keeping an eye on gastroparesis or delayed stomach emptying, especially with higher doses over time. But overall, for most people, Wegovy has remained safe and effective when monitored regularly. What does monitored mean? It means your doctor should be checking your kidney function, digestive symptoms like nausea or bloating that do not go away, mood changes, particularly if you have a mental health history, and your nutrient intake, because smaller appetite can sometimes lead to deficiencies if meals become too limited. Some providers also space out check-ins once you hit maintenance, maybe every 3 to 6 months instead of monthly. Now, is there ever a point where you should stop? If you reach your weight goal, have sustained it for a while, and have a clear nutrition and exercise plan in place, and your doctor might decide to taper. But even then, many patients choose to stay on a maintenance dose instead of stopping completely. Think of it like antidepressants. For some people, they are temporary. For others, they are part of lifelong care. Neither is wrong. It just depends on what your body needs to stay balanced. The future? Longer studies are in progress. The SELECT trial, which looked at semaglutide and heart health over multiple years, is giving us even more long-term data. But for now, if you are tolerating Wegovy well, and it is helping you manage your weight and health safely, most doctors support continued use with regular check-ins. If this gave you clarity or helped ease the worry, like this video and share it with your loved one. Long-term meds can feel intimidating, but good info makes it manageable. Coming up next, what happens if you do stop Wegovy? The rebound effect is real, but it is not inevitable. Subscribe so you do not miss that guide. And tell me in the comments, are you thinking about staying on Wegovy long-term or hoping to taper eventually? Let us compare notes.